I grew up frankly luckier than most people. I grew up the son with one of three boys with two loving parents. My father is a family doctor who made house calls, who served with even people that couldn't, regardless of ability to pay, and he taught me about what healthcare should be all about, and taught me about what economic justice is all about. I grew up the son of a mother who was just absolutely incredible. Many in this room knew my mother. My mother really taught. My mother was very involved in the YWCAs around the state. The YWs probably fought for economic and social and fought for women's rights and civil rights perhaps more than any group in this country over the last many decades. My mother, as many of you know, died in early February at the age of 88. She, right up until the end in November, she ran the local senior citizens levy campaign and passed it, of course, because it was my mother doing it. And she got sick in mid-December. We were with her the last month of her life, or the last 6 weeks of her life. She was home, and I just wanted to briefly say how much, what incredible people that do hospice home care are. And so many of you, have taken care of a dying son or daughter or mother or father or husband or wife or sister or brother and know what that means, and the empathy they summon up for people they don't even, if they've never met before, is just astounding. My mother was alert and talkative until the last 48 hours or so of her life, and about a week before she died, my wife Connie, maybe if you know Connie, and my brothers and I were all around, and my mom said to me, she said, "Would you sing a hymn to me?" And we grew up in the Lutheran church, so I went in the other room and I got our red Lutheran hymnal, and I sang a song. Pastor Lentz, you may know that. This is not a Presbyterian song, but nonetheless, it's a song. It was a song called "Beautiful Savior." I won't sing it to you, but it was "Beautiful Savior." And I stood by my mom's bed and sang her, I think, 3 verses of it. And she said, she kind of lay back as she was lying there, and she smiled. She said, "That was really nice, Sharon." And she said, "But you know, you really sound better in a group." So I got that. Tell me we all didn't have parents like that. They never miss a chance. Thank you. First, just thank you for being here, most importantly. But, well, more importantly than that, thank you for your activism. Thank you for your fight, the fight you all have in you for social, especially you over there, for social and All right, hold it. But, you know, I look at what you've done in 06 and 08, in what you've done, not just at election time, what you've done between elections. It's so important. But prior to 2006, not that long ago, you remember, in those days, the drug companies wrote the Medicare law, the health insurance companies wrote the health care law. Well, those days are over. In 2006, you said, you in Ohio and all of us around the country said, no more the conservative era with tax cuts for the rich, unending war that our grandchildren pay for, the drug companies writing the Medicare laws, the big companies that outsource jobs write the trade laws. We said that era is over. Then in 2008, with the election of President Obama and the election of others around the country, what we did was we, all of us together, launched a new progressive era in this country. That's why this is our opportunity now to do national health care reform. Now, so several years ago, there was a study done of the United States healthcare system, comparing us with healthcare systems around the world. They took several different indices of measuring healthcare performance, and they rated the U.S. and rated the 13 richest industrial democracies in the world. Life expectancy, infant mortality, maternal mortality, immunization rates, all kinds of things like that. In the United States, of the 13 richest countries in the world, we came in 12th of the 13 in healthcare indices, even though we spend twice as much as anybody else. But I tell you that not to depress us, but I tell you that because there was one category where the United States finished near the top. And that category was life expectancy at 65. So in other words, if you get to be 65 in this country, if you live to 65, you're likely going to have a longer, healthier, more productive life than people almost anywhere else in the world. Why is that? Medicare. That's exactly right. And that's why the public option. That's why the public option in this health care bill is so important. We're going to regulate insurance companies way better than we've done. No more community rating, no more keeping people out, no more pre-existing condition, all of those things that the insurance companies use to game the system. But you all know that that's never enough with the insurance industry, because the insurance industry, they're basically always kind of one step ahead of the sheriff. They always, no matter what we do, what kind of rules we set up, the insurance companies, they're smart. They got good lawyers, they got smart people. They figure out how to beat the system. So this year, rather than just regulating the insurance companies, as we're going to do, and we're going to do it better than ever before, but that's why we need the public option. A public plan like Medicare, a public plan that when you decide, if you're uninsured and you decide you're going to get insurance, you can choose a private plan if you want, that's fine, or you can choose the public plan. But we know with the public plan there, one of the things that we'll do is we'll keep the private plans a lot more honest, and that's the whole point of the public option plan. I mean, a lot of you want single payer. I'd love to see single payer. We're not going to have that, but we're going to have the next best thing. So, I want to close with this. I want to close with why I'm more optimistic this year than I've ever been. When I came to Congress in 1992, some of you might remember this, I made a promise that I would pay my own health insurance until my 92 campaign, until Congress passed health insurance. And thanks for that. Well, I figured we'd do it right away. I didn't know that was going to happen. But in those days, we weren't able to pass that in 1993, as you know, in large part because the insurance industry was so smart and spent so much money, and Democrats, frankly, didn't have enough spine and didn't fight back. And also in 1993, business interests, not just insurance, but other companies weren't much interested. This is a very different time. But I'm also optimistic because I sit in this room and I see the excitement, I see the commitment. I know many of you here. There are many of you I've never met before. I also know that there are hundreds of thousands like you around this state, around this country that are going to fight too. And I also know from American history, when people in this country really want something to happen, it happens. And I want to illustrate why I believe that and why I know it's true. I apologize to those of you that have heard this, but I wear a lapel pin depicting a canary in a bird cage. If I've worn this for about 10 years, and thank you, Chuck, for wearing it too. And you know the story. The mine workers went down in the mines, and if he was carrying the canary, and if the canary died from lack of oxygen or toxic gas, the mine worker knew he had to get out of the mine. He had no union strong enough to protect him 100 years ago, and he had no government that cared enough to protect him 100 years ago. He was on his own. And in those days, America had a life expectancy of about 45, 46, 47 years. Today, we live 3 decades longer, not because of high-tech medicine. Gus, that really matters, of course, on everything from heart transplants to chemotherapy and all that. That helps some people. But we live 3 decades longer in this country today because of what progressives have done fighting to make this country better. It's Medicare, it's Social Security, it's minimum wage, it's food safety, it's prohibition on child labor, it's women's rights, it's civil rights, it's safe drinking water and clean air laws, it's seat belts, it's airbags. It's all the things that government did. And government did it not because people like George Voinovich and me just do the right thing. Well, some of us do. But it's mostly because people like you push their government to do it. It's people in their union halls, people in their church basements, Pastor Lentz, people in their ethnic organizations, and advocates for women, and advocates for children, civil rights, and advocates for children, and all of that. And you look at the progress we've made in the last 100 years, from the time when the canary went down in the cage, on all of these. And it's meant a strong middle class. It's meant educational opportunities for young people. It's meant people like my wife, who came from a family, never gone to college. She got to go to Kent State and left that school with only a debt of like $2,000 back in the old days when we gave opportunity to kids going to college. When you think about all those things we're able to do, that's why I know that you're going to deliver, that we're going to make this happen, that we together are going to see this Congress pass by the end of the year national health care reform.